Welcome to the Flavor of South Florida, a weekly show review.
Welcome to Black Health, a talk show discussing medical issues impacting and afflicting the Black community. Now introducing our host, Dr. Michelle Kirwan.
Good afternoon, everybody, and welcome to Black Health. I am Dr. Michelle Kirwan, the host of Black Health. I am a board-certified pediatrician and also the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. Today's show is about Alzheimer's disease, and here to take us through this very important topic is Miss Caryn Blair.
Hello,
Ms. Blair,
hello.
welcome to the show.
Thank you so much, Dr. Kirwan.
I'm going to take a moment to introduce you. Ms. Blair is the Senior Manager for Research Support at the John P. Hussman Institute for Human Genomics at the University of Miami Miller School of Medicine. She's an experienced healthcare provider who has extended culturally sensitive professional nursing services in various clinical and research settings to patients across the lifespan. Nurse Blair is board certified by the American Nurses Credentialing Center as a psychiatric mental health nurse practitioner. Her current role at UM includes supporting efforts to recruit, enroll, and retain African American participants for Alzheimer's disease studies. Furthermore, she supports efforts to collect biological samples and phenotypic data of the African American population for Alzheimer's studies. Nurse Blair is currently completing a doctorate in nursing, where her area of interest concentrates on maximum support efforts for caregivers of patients with Alzheimer's. Via speaking engagements and local collaborations, she has been instrumental in bringing awareness to the plight of Alzheimer's caregivers and continues to be a force for positive change in this effort. Ms. Blair, thank you for joining us today, and wonderful bio that is, wonderful work that you're doing.
Thank you so much, Dr. Kirwan, for the introduction.
Absolutely. So tell our audience about the Hussman Institute. What do you do? What is your mission? And how long has it been around?
So the Hussman Institute has been around since January of 2007. And the Hussman Institute, we sometimes refer to as the HIG. We seek to discover the genetic influences of human health and apply this knowledge to the practice of medicine through improved diagnostics, treatments, and medications to improve human health. There are several disorders under investigation at the HIG, and one of those disorders that I'm very involved in is Alzheimer's disease.
Okay, and what are some of the top priorities for the HIG? I'm gonna now call it the HIG.
So one of the top priorities is getting information that will help to address treatments for certain disorders. In this case, we're going to be talking about Alzheimer's disease. Mm-hmm. They're very involved in the efforts towards precision medicine. Precision medicine, it's a vehicle used to help doctors and other scientists to find unique disease risks and treatments that will work best for certain populations and individuals. So we're focused again on precision medicine and contributing to mitigating the issues that come along with different disorders.
Okay, so precision meaning you're personalizing it in a sense.
Targeting
towards individuals.
Correct.
Which I think is very important. Yes, I think that's very important. It's not something that we were looking at when I was in medical school and residency. And by the way, I was at University of Miami Miller School of Medicine, so I was there in your stomping ground. And I think it's just fascinating and wonderful that we're looking more, we're being more precise, precision medicine about what we're doing in looking at our patients and individualizing our care.
That is the way of the future.
How do the efforts at Hussman Institute contribute to personalized medicine in terms of combating dementia?
So at the Hussman Institute, the HIG, we're seeking to discover genetic influences on the human health and apply again the knowledge to medical practice. We're aware that most of the studies of genetic association with diseases have been performed in Europeans. That European bias has important implications for the risk prediction of diseases across populations. Because we know different ancestral groups have different genetic factors, risk factors, we at the HIG are seeking to promote participant diversity in biological research. And by that I mean, Dr. Kirwan, we're promoting our African American participation in studies that address the genetic factors, in this case associated with Alzheimer's disease.
Okay, very good. And why study genetics?
So when we look at genetics, we're talking about the genes, the information that's passed down through your cells from generation to generation. For example, like heart disease, diabetes, and again, in this case, Alzheimer's disease.
Okay, so when we study genetics, are we then able, and according to what research shows, are we then able to develop new therapies based on research?
Absolutely, we are. Again, this type of investigation will lead to information that we can use to create targeted therapies for certain disorders.
Okay, so we're looking at people as individuals and we're targeting therapy. So does that mean that the same treatment will not work for everybody or will work for everybody?
Correct. So it is very important in precision medication that we look at not just the broad treatments that are out there, but that we look at population-specific treatments, because not everyone is the same. So that's where, again, the precision medicine comes in. And that's why we need participation from the African American community so that we can create therapies that are specific to the needs of the African American population.
And so you're targeting a population, not necessarily a person, or does this eventually get down to the individual level?
So I think in the future we will be talking more about individual, but right now we're talking about population. Oh, okay. And in this case at the HIG, we're looking at the African American population and the Hispanic Latino population as well.
Okay, I'm following you. Great. So let's switch gears and talk a little bit about Alzheimer's and dementia. Yes. What is Alzheimer's disease?
So Alzheimer's disease is a type of dementia. Mm-hmm. And with this disease, we're looking at two proteins in particular in the brain, both of which are normal to have in the brain. But in the case of Alzheimer's disease, these two proteins, there's an abnormal buildup, if you will, of these proteins. And because of the abnormalities with these proteins, they damage nerve cells. And in damaging the nerve cells, there's a particular area in the brain that is negatively affected in terms of memory. That's why with Alzheimer's disease, you see people with memory disorders.
Okay, very interesting. And what part of the brain is affected?
So there is a part of the brain referred to as the hippocampus. Mm-hmm. And in that part of the brain, that's where that's where memory takes place in the human brain. And in that area, also, I want to mention that with the brain and Alzheimer's disease, you see shrinking of the brain as well. Mm-hmm. You see damage to the nerve cells, but you also see shrinking of the brain.
Mm-hmm. So if I want to sound really intelligent, when I forget something, I can just say my hippocampus is acting up, or?
Yes, you might say that. And there's also another area of the brain which we refer to as the amygdala. Mm-hmm. And in the amygdala, that's where we have a lot of emotions. Okay. So when that part of the brain is negatively affected, you'll see people with behaviors, maybe aggression, inappropriate social behavior that you might observe with an Alzheimer's dementia patient.
So that actually leads me to my next question. What are the most common symptoms of Alzheimer's? So memory loss, and then what you just mentioned. Is there anything else?
Right. So memory loss is huge. For example, it might be easier for an individual afflicted with Alzheimer's disease. It's easier for them to have a memory from childhood as opposed to a memory from something they did early in the morning, let's say. They might forget what their glasses are as opposed to forgetting where their glasses are. Yeah. For example, many of us might misplace our glasses. That's one thing. But it's another thing to not know what the glasses are for.
Yeah. Yeah. Wow. So as I get up in age and I find it harder and harder to remember things like, names, not my own name, I'm not there, but dates, things like that. Sometimes I think about it, like how does one know if they have Alzheimer's?
So again, some of these symptoms related to memory are very important to recognize that one might be having a problem. Remembering dressing inappropriately, let's say, the memory loss issue, inappropriate behaviors, especially in social gatherings. Those might be symptoms.
How much memory loss is normal for, just for one's age? So if you're in your 30s or maybe your 40s or even your 50s, is there a certain degree of memory loss that is just considered normal?
So as we age, we change, right? And maybe our recall is affected, but you're going to see with Alzheimer's disease, early onset is considered anything before age 65. It's when you get to age 65 and older that you tend to see the Alzheimer's disease in effect. Okay. Anything before that is considered early onset.
Okay. We have a question here from a viewer. Can you do anything to prevent Alzheimer's?
So there is some research that's looking at what we call social determinants of health that may influence whether one is afflicted with this or any other disease. So there's some research that suggests that perhaps education, there might be some environmental factors, nutritional factors. That's why this research is so important. The research is taking place now, and we need our community to participate so that we can know exactly what is it within our community that can help us, that might be protective factors against this disease.
Okay. How common is dementia or Alzheimer's in Black people?
So unfortunately, we are 2 times more likely to be afflicted with Alzheimer's dementia.
I did not know that.
Yes.
I did not know that.
It's huge. A huge problem.
2 times more likely.
Yes. So that, again, speaks to the importance of us getting involved in this research. Not only are we 2 times more likely to be afflicted with Alzheimer's disease, but as many of your audience members may know, most Alzheimer's disease patients are being cared for at home by a loved one, a family member, or someone who is providing unpaid caregiving services. So this disease not only affects the individual who's suffering with it, but also to the caregivers who are taking care of them. And that those caregivers make up 2/3 of the people that are being cared for. 2/3 of them are women that are providing care to the Alzheimer's dementia, Alzheimer's disease patient. So it is a disease that is very burdensome to all involved, including us as practitioners, Dr. Kirwan, in the sense that this disease, we need to get our community involved in it, in research, but we also have to be aware that those caregivers that are out there taking care of the patients, we need to take care of them too.
Yes, caregiver burnout.
Absolutely. So that we can have best outcomes for the patients and the caregivers.
Yeah, it's very scary because there's so much that can happen, and you can't keep an eye on a person your every waking moment. But you see in movies, people with dementia, Alzheimer's walking out the door, wandering away. You hear about that in real life, not just in movies, obviously. You think about things like, even with my parents, and they don't have dementia, but they're in their 80s and they're getting older. And you think about things like leaving the stove on, or, things that potentially could start a fire, or so not only is taking care of the loved one, a great feat, but just the stress and the worry, not just about your loved one, but about the things that could happen to them, to the home, to you. You leave a door open and somebody comes in. It's just that there's a lot to be looked at in that area.
You're so right. And again, this is why it's so important for our community to get involved. And this is why the work that we're doing at the HIG is so important. I'm so proud to be a part of an institution that's looking at treatments specific to our community to help to mitigate some of the burden that comes along with an Alzheimer's disease diagnosis.
So it's twice as common in the Black community, which still has me completely thrown off. I didn't know that number, and that's very
disturbing.
It's very disturbing. Why is it that Black people suffer at increased rates with dementia, with Alzheimer's?
So again, we at the Hussman Institute, the HIG, we're looking into that. Why is it that African American individuals are 2 times more likely than most to be afflicted by Alzheimer's disease? We're looking at, again, the environmental issues, the other factors that might affect us. Could it be our cardiovascular issues that we also deal with? There's so many different areas that may speak to why it is we are more afflicted. And that's what the work at the HIG is about. Really determining what is it, and again, coming up with therapies, helping to come up with therapies to target those issues. Even if we were to address those social determinants, we're still talking about a genetic risk factor at the core. So that's what we are focused on at the HIG.
Okay. So taking away the social determinants of health, we still have a significantly increased risk just based on genetics. So absolutely, in that regard, I mean, our genetics are our genetics. We can't change that. But I guess at a minimum, we can address the social determinants of health, our stress levels, the things that we can look at. Which brings me to another question: is stress one of the things that is looked at at the HIG for a risk factor for Alzheimer's?
So again, at the HIG, we're doing the genomics. We're looking at the genes, right?
Okay.
But we have acknowledged that there are some, again, social determinants of health that need to be looked at as well.
I see. Okay. So what should somebody do if their loved one is showing signs of dementia?
So I would encourage that individual to bring that to the attention of their primary care physician. Perhaps they're going to end up going to see a neurologist for further evaluation.
Yeah. Okay. And why, I think you touched on this a little bit earlier, why, and I'd just like for you to speak on it again, why is diversity in research so important? And maybe how can we get the Black community to come out and be a part of your research in particular at the HIG?
Thank you for asking that question. Why is it so important? Again, this is a disorder that's really hitting our community hard. Mm-hmm. And without our participation, our ability to benefit from that targeted precision medicine is limited. Mm-hmm. So we need to be there. We have the ability to get involved so that we can bring some relief, if you will, to our community through participation in the studies.
And so you're really trying to reach the Black community, and that is Black, African, Caribbean, African American, the diaspora. All
exactly.
Black and
exactly.
Hispanic. I think you said Hispanic as well.
Well said. We're looking at the African diaspora, and we're also looking at the Hispanic Latino population as well.
Is there risk for Alzheimer's as high or higher than the white population, Hispanic?
No, we have the
highest.
Twice as likely.
Yeah. And then Hispanic is so under us, and then I imagine they're being targeted because their numbers may be increased as well. Okay. So what does the process for participation entail? How does one become a part of your research program?
So again, thank you for that question. I think we're providing our website here, and you can also call anyone who's interested. That would be 305-243-6343. We're here to welcome you. We're excited about getting you involved in this incredibly important research that will help to bring solutions to this problem.
I think they just put the number up, 305-243-6343.
Correct.
So we encourage anybody who is listening, especially those of you with loved ones that have Alzheimer's, why not be a part of the potential cure, or at least decreasing our numbers, and see if there's a way to do that. So what does it look like when somebody calls and they sign up and they want to be a part of the research program? Maybe it would be helpful for people if they kind of knew what was going to happen, once I got there. Can you tell us a little bit about what actually goes on?
Sure. So we would welcome people who are interested to invite them to come to our facility, where we would gather some data from them in the form of questions and take a sample of blood. We can either invite individuals to come to us, or we can go to you.
Oh,
this is that important that we have outreach. We will go to you to gather this information. Absolutely.
Okay, excellent, excellent. So again, that number is 305-243-6343. And Ms. Blair, is there anything else that you would like the audience to know? Any other words of wisdom or encouragement so that we can all tackle this issue together?
Well, you just said it, Dr. Kirwan. We can tackle this issue together. We have the ability to do it. And furthermore, we have the facility, the support to do it at the Hague. I'm part of that effort. I work with a great team of people. We have the ability to make a change for our community through the efforts at the Hague.
And, you know, historically, I know research has not been the friend of the Black community. And so I think it's very difficult for a lot of Black people to move past that and to enroll to be a part of a research program. But, you know, as I do this show more and more, everything we're talking about, you know, the disparities, we're always the highest. We're, you know, bearing the brunt of many of these illnesses and diseases that exist. And I think it's just really important that we start to participate in these programs like at the Hague, that we can start to address these issues and help ourselves. We have to help others help us. And really the only way that we're going to do it is through research. And unfortunately, research was used against us. And now the fear of research is working against us. So thank you for all that you are doing at the Hague, and thank you to the Hague itself. It's just wonderful work, and even more important, knowing that we are twice as likely to have that is twice as prominent in the Black community, Alzheimer's, that is. So thank you again for joining us. I'm going to take a moment to say thank you to our sponsors. And that is FAMU, Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. FAMU, Medical Marijuana Education and Research Institute. So Ms. Blair, that brings us to the end of our show. Thank you again for being on and taking time out of your busy day. And I'd like to say thank you also to our audience for watching. And as I always say, if you have any topics that you'd like for us to cover, please feel free to reach out to us and let us know, and we will be sure to do that.
Thank you, Dr. Kirwan, for having us. We appreciate it.
Absolutely. Thank you. And everybody out there, have a great day. And we'll see you next time at Black Health.